Our article today is Matching Therapeutic Style with Developmental Level by Thomas P. Bolus. And I'm going to pass it on to Jeshen to go over the author of this article.
Thank you, Sully. The author of this article is Thomas P. Olds, and they are an associate professor in the social work department at the Skidmore College. The purpose of this article we find is that the author discusses the guidelines provided by Ellen E. Ivy in their article named Developmental Therapy Theory into Practice, and the guidelines mentioned in that article. So the author tries to use those guidelines to build upon and to improve the interventions that we use or we work with the youth in residential care. Next, I will pass it on to Vicky to discuss the further questions.
All right, thank you very much, Jeshen, for that brief introduction. Now, our article I found is a discourse analysis paper that the author utilizes to discuss some of the guidelines for using cognitive developmental assessment in our interventions. And throughout this paper, he interprets and contextualizes the therapeutic style of doing in child and youth work and how it integrates the developmental perspective. I feel the author's big question in the article was, do the available therapeutic principles and techniques embedded in child and youth daily interactions truly incorporate the developmental stages? And how do we build upon these to improve the interactions that we have with youth in residential care? Now, he also points out that much as the CYC workers are good at recognizing behavior as developmentally appropriate or not, they have the most generic of techniques to apply in the service of promoting development. And his major concern here is that this lack of specific style is a serious limitation to the developmental perspectives. About the problems that I might have noticed, like I mentioned, these are guidelines that the author believes will help. And I actually like the fact that some of these are still individualized to respond to particular needs of a child and the style of the workers. For example, he mentions that to maximize the utility of developmental perspectives, child and youth workers would need to describe programs or interventions in ways that are complementary to the residents' means of understanding, even when it means that the same program may be framed differently per child or per youth worker. And one good thing, according to the article, is that most youth care workers are aware of the developmental stages and they're very consistent with providing the necessary conditions for growth. However, the challenge, according to the information, that few of child and youth care workers have been able to individualize a focus on promoting development. So that's what I had, and I'll pass on to Abby.
Thank you, Vicky. Some of the ideas presented that we found useful to future practice is the chart assessment tool that can be used with supervision. The assessment allows to match what interventions take place in the therapeutic style to the youth's developmental level and can be used to define their expectations of residents and their behavior. There are 4 stages of cognitive development in youth, which are sensory, motor, pre-operational, concrete operational, and formal operational, which support the cognitive developmental assessment to guide intervention and match therapeutic style appropriately for the youth at the different levels. This assessment is also helpful because it is individualized for developing goals. So their findings or outcomes. The approach was very helpful and beneficial for the 2 youth that were mentioned in the article. The author stated that the youth made use of their time with the social worker and was less vulnerable with negative feedback and focused on their time and placement. At the end of the youth placement, they collected their findings by having the youth fill out forms that included questions like, what would you do if the behavioral strategy didn't work, and what ways in your current approach was representative or patterned. Their conclusion was a plan accomplished their goals, and there was room for flexibility in the youth coping approach. I will pass it off to Soli.
Thank you, Abby. I will be now going over the things we may have disagreed with the article, and I can say that we don't really disagree much with the article, as it does make sense. Approaching youth where they're at. It's you know it's all we do. Meeting them where we're at, and it kind of ties into our current skill immediacy in some ways. Um, However, there are things that could be improved upon with this article, in that having a deeper and better understanding of the cognitive development of children and youth, specifically down to like the nuances of their behaviors and cognition, would go pretty far in figuring out what therapeutic practices we use on certain developmental stages with the youth. And I will now pass this off to Jasmine to wrap us up.
Thanks, Sully. Next, I'm going to be talking about the relevancy to child and youth care practice. So the relevancy to child and youth care practice in this article talks about this paper having provided guidelines for matching a child and youth care worker's intervention style with a residential developmental level. The guidelines improve the child and youth care workers' ability to use developmental assessments in treatment planning and routine life space intervention. The discussion focuses upon Pagan's perspective on development, partly because of their continued relevance and partly because of their widespread use. Recent work by Ivany, 1986, remedies this problem by offering specific guidelines for use of cognitive developmental assessment and clinical interventions. Next, I will discuss the critical thinking question our team came up with. So, would you use the cognitive developmental assessment chart in your current child and youth care practice? Why or why not?